To begin Practicum within the PsyD program, you'd have to have all the 10 core courses completed, and you need to have to submit to your academic advisor proof that you've done 24 hours of personal therapy. If you've done personal therapy in the past, you just have your clinician write something up on their letterhead stating, for example, John Smith was in personal therapy with me from June 2008 to June 2010, during which time they had done 24 hours of personal therapy. There's two criteria for the actual practicum. One is that you're seeing people in a clinical setting. It could be at a hospital, it could be in your private practice if you're already practicing, it could be in a community setting if you're already practicing. It could be a domestic violence shelter, a chemical dependency environment. As long as you're seeing people clinically, that would count towards your practicum. The other requirement is that you're being supervised by a licensed psychologist or psychiatrist, and the licensed psychologist or psychiatrist does not need to be on the site in which you practice. Once you find the site, we have a Practicum handbook that's available to all of our learners within their website. And from there, they'll be able to fill out a site agreement, a supervision agreement with their supervisor, and that would get them into the Practicum. The Practicum is over 2 courses. Each course is 80 hours in length as far as the Practicum requirement. So it's 160 hours total. The supervision that you're getting from your supervisor, licensed psychologist or psychiatrist, does count in those hours. And the ratio from clinical hours to supervision is 10:1. So for every 10 clinical hours you'd be doing, you need to be supervised by the licensed psychologist or psychiatrist. The Practicum itself can be completed at your own pace. Some people are seeing patients for 40 hours a week, and you can do all 40 hours in 2 weeks and be done with the first practicum or one practicum. And, or you can, if you're not working within the field, you have the option only in practicum to take it over 16 weeks instead of 8 weeks. That way you can find a place where you're doing 3 or 4 hours a week, and over the course of 4 months complete one practicum, and then do the same thing for your second practicum. One of the great things about the program is a lot of our learners are already working in the field in private practice or an agency, and they can just, it'd be business as usual for them for the practicum. They can continue to see their patients as they would and get the credit for the hours that they would see the patients at their private practice, community setting, hospital setting, and then make sure that they have the supervision outside of there from a licensed psychologist or psychiatrist that they have available. I can remember one student in particular who was having trouble finding a practicum placement. I know that the Salvation Army continually accepts practicum students for their chemical dependency program, and they went down that avenue and were able to secure a practicum placement with the Salvation Army, and then got supervision from a licensed psychologist outside of their practicum site. We always refer people to a Rainbow book that is used within our field that has a ton of sites that are available to people. We also have another academic advisor who's continually working on building our database for practicum sites that are out there. Yeah, for those of people that have a tough time finding a psychologist or a psychiatrist in a remote area, we allow for people to use Skype or video conferencing to do their supervision hours.